This video is going to be for anybody with knee pain. When you have knee pain, you can start to have an inability to put weight on your knee. So let's say you were going into a lunge stretch or wanted to put weight down onto that knee. People with a lot of pain in their knee, they lose the ability to hold weight on their knee. But for fixing and improving and managing a knee issue, you're going to want to be doing hip extension. You're going to want to keep that alive. So I'll show you a strategy. So we're not going to directly drop the weight onto the knee to get into this position. We're going to use a chair or a bench. And what I'm going to do is I'm going to sit on that bench and I'm going to get into a lunge situation. Having a wall is nice for balance. I'm going to take this left hip and I'm really going to reach it. So I'm getting into this nice position. There we are. And now I can start to take this hip, which is very desirable for a knee problem, and I can really start to stretch that leg back. I can do a little exploration in hip extension, but now in this lunge position, the knee is unloaded. Now I can start to go into some spine stuff because the hip flexor comes up from the leg, crosses the pelvis, and becomes the lumbar spine. So these hip extension and spine stuff are all related. So in this position, I'm simply going to do checking with my rotation. Nice, clean rotation. That's why the wall is really nice, because then it's not a balance exercise. And then the next thing is side bend. And then I might start to add some complexity to that, checking in with different ranges of motion. There we go. So if you have knee pain to the point where you can't load the knee anymore, so you can't put your body weight down on that knee, it's just too painful, don't stop, because it's going to be important to continue getting hip extension. Just pop up your pelvis and then really start to drive that hip into extension, and then don't forget everything that's going on down at that hip is really integrated with these spine motions. So get all of those and you're going to start to fix and manage that knee pain.